Belgium, and we have in our practice a specialized referral ambulatory practice, which means that we do a lot of internal medicine on the road, and that has allowed us to see how important the environment and the management of the horses' feeding and bedding was essential to its respiratory health. So it's a little bit of that experience that I'd like to share with you today. This is a graph showing the proportion of horses affected by respiratory diseases depending on the type of equestrian discipline they are involved in. So we have horses, race horses like thoroughbreds and standardbreds, but we also have endurance horses, leisure horses, show jumpers, etc. Whatever the type of discipline you consider, over 50% of the horses are affected by inflammatory airway disease or some form of lower airway inflammation. Now you know like me that inflammatory airway disease can take its toll on the horse's performances, and it's really essential that we are able to manage that. However, it is intrinsically linked to the horse's working and life conditions, because these horses are on the road to go to competitions. They are housed in dusty environments. They can work on tracks that are also dusty. They mingle with a lot of other horses that have germs that are different from their own, so it's a little like having kids in daycare. And we can act on only a few of these things. Environment is the major part on which we can have some impact. So as health specialists, it's very important that we are able to share with our owners or the trainers some good tips to avoid having these horses carry a lower airway inflammation or disease that would eventually impair their performances. Now, I'm always intrigued, even in very nice stables, how dusty the environment can be. This is an example of a groom that is brooming the central air line in the horse's barn, and all that dust, where is it going to go? He's going to open a door of one of the stalls and put it inside directly the horse's box. And usually that's also where the hay goes, so the horse is going to eat hay and inhale all that dust. At this time of the year in Belgium, like in other countries, it's a very cold time, so the people that work inside the building tend to close the doors, and horses, just by merely breathing, produce a lot of water and a lot of heat, and you can see the condensation on the windows. So that increases the humidity in the horse's immediate environment. That humidity increases also the risk of having fungus and bacteria grow inside the horse's environment. And if there is poor ventilation, then of course heat and humidity is going to promote growth of contaminants. So that has been published in a very nice study by a Canadian group, where they showed that there was a direct link between the temperature and the humidity in the horse's immediate environment and the horse's clinical symptoms, with an exacerbation of the clinical symptoms linked to equine asthma when you have a rise in temperature and humidity in their direct environment. Initially, horses were meant to pasture all day in very open fields. As soon as you put them inside a box, you multiply by 50 the amount of particulate matter that they can inhale. And that dust is not just dust. It contains fungus and bacteria and mites, as well as endotoxins, as well as ammonia. All this goes directly into the horse's respiratory tract. And they have the same respiratory tract as we have. That means that their immune system will be challenged by all these things that they inhale. Sometimes the owners that we see say, well, I do everything for my horse. These horses are outdoors 24 hours a day. However, they still receive hay, and in that hay, you can still find the same contaminants. So despite the fact that they're outdoors 24 hours, even if they receive hay, that is a risk factor for having respiratory diseases. Now, we've focused more recently on fungus, and I've been interested in studying these fungi. Tomorrow I have a presentation also on that topic. And when you look at the human literature, it's very interesting how fungus interact with airways. They can be infective and cause fungal infection. They can produce toxins, mycotoxins, that affect the integrity of the immune system, the integrity of the epithelium of the airways, but also have a neuromuscular effect, and that can affect the stability of the upper airways in some cases. In some horses that are sensitized, they can be allergenic as well. Now, depending on temperature and humidity, you will have different profiles of fungus that can grow inside the environment, but also inside the airways. And that is highly problematic for horses. And this graph, it's been done, it's a study in human medicine, and they've resumed all the effects that the fungus have on the different cell pathways and how they trigger inflammation, both neutrophilic, mast cells, and eosinophilic inflammation. Now, in humans, we have a wide range of fungal-associated disease. Unfortunately, in horses, we're very familiar with guttural pouch mycosis or pulmonary aspergillosis, but we're not aware that there are other problems like asthma or farmer's lung, similar diseases to that can also affect horses. So milder forms of fungal-induced inflammation in these horses. We did a study where we looked at 731 cases of horses that were referred to our practice for poor performance or any respiratory issue. And we did a series of exams, clinical exam, reporting what environment they were in, as well as an endoscopy and 2 samples of tracheal wash and a bronchoalveolar lavage. Now, systematically recorded the presence of these fungus inside the sample. So we did the cytologies ourselves and noted if there were a little bit or a lot of fungal elements, and if there was any signs of fungal proliferation. So you can see here on the right a little fungal spore that has started to germinate. This does not happen usually in airways, in normal functional airways. It either means that the immune system is completely overwhelmed or that there is a heavy burden inside the horse's environment. So out of all these cases, we showed that 88% of the horses that had poor performance were IAD positive, and that's a very, very high prevalence. Now, of course, you have to bear in mind that these are cases that are referred to a specialized practice, but still, I think it's very high in terms of numbers. Now, horses that had fungal elements, even if they were not proliferating, had 2.1 times more chances of having inflammatory airway disease. So controlling these the fungi inside the environment really is essential for us to prevent inflammatory airway disease in horses. So then we were interested in looking at management practices. Would there be anything that we could do to help them? We saw that if the horses were on a straw bedding, even if the straw looked nice, it was an increased risk of developing inflammatory airway disease. But also using dry hay, because dry hay, despite the fact that it looks perhaps healthy, is a source of contaminants and fungus. In our study, we did not show that haylage had any effect, and that is probably because some of the haylage that is made is not appropriate. Some of it can be not adequately wrapped and can be contaminated. So for me, it is not a recommendation that I can give to my owners. They like to soak hay, but unfortunately soaking hay can increase the amount of bacteria and fungus. I'm just going to show you a slide afterwards. The only protective measure that could be taken was using steamed hay. So using steamed hay reduced by more than twofold the risk of having fungus and subsequent inflammatory airway disease. Now, clinically, these horses, if you look at race horses, if they have inflammatory airway disease, they're not going to race as good, and they're going to slow down. But I'm also always very surprised at horses that are diagnosed with IAD, that are sport horses, how pretty specific some of their complaints of their owners are. Horses can be referred for lack of breath, of course, but also a horse that feels uncomfortable, difficult to condition, it takes longer to recover, not necessarily cough or nasal discharge or dyspnea. When we looked at our clinical cases, horses with fungus had cough, but not that much more than horses without fungal proliferation. One thing that was more prevalent was epistaxis. So some of the fungal strains do have an effect on the integrity of the capillaries. And that is something that we look at systematically in our cases of exercise-induced pulmonary hemorrhage. Do they have yes or no contaminants? Now that's true for racehorses, but in a retrospective study of 900 horses that had exercise-induced pulmonary hemorrhage, show jumpers exclusively, we showed that these show jumpers with fungal particles in any sample, either the BAL or the tracheal wash, had 2 times more chances of having exercise-induced pulmonary hemorrhage. So I think that's a very important also thing to remember, is that it's not just lower airway inflammation, it's also EIPH. So now with all this knowledge, what do we do? Well, we need to be experts in assessing the environment. I think that if you have an ambulatory practice, or if you do go out to see some barns, you have to train your eye to look at the different risk factors that are around you. How's the ventilation in the building? Do you feel humidity when you're there? You can measure it as well. We've got little monitors. Is it dusty? And that's why it's interesting to go early morning when they're cleaning up the stables, because that's when you're going to see if it's dusty or not. Look also up on the roof. Do you see all the lights that are over the horses? Do you see dust? That is fine dust, that are inhalable particles that can trigger inflammation. And then have a look at the bedding and the forage, because changing the bedding and changing the forage can make a huge difference. You can also help them manage their storage areas. On the left here, you've got a storage area that is poorly kept. So the hay and the straw are directly on the ground, which makes a very good source of contamination and repeated contamination. So they take this hay and straw and then distribute it in all the different boxes. So we can use disinfection, but what we need to do is control at the source the fungus that we have. So for the bedding, use a bedding that is a little bit more controllable in the contaminants. So cardboard bedding or paper bedding, or even wood shavings are a better option than straw. And then as we looked at the different modalities for the hay, we showed that steaming the hay was the most effective measure that you can take. This is a study done by Professor Moore-Poehler, where she looked at the amount of moles that you had in different types of hay. So dry hay, hay that was soaked for 90 minutes in a bin, steamed hay with a Haygain HG here 600, and you can see that the lowest level of contamination is with steamed hay. The highest level of contamination would be in dry hay or in hay that has been soaked for over 30 minutes. So, steaming the hay, it's also very important that you use an appropriate hay steamer, and the Haygain machines have been designed and proven to be the most effective way of steaming hay. The hay can be heated up at temperatures above 212 Fahrenheit in a very homogeneous way. So you've got spikes that are inserted inside the hay and that ensure that it is steamed to the core. I've had horses owners that make their own steamers, and horses still have problems. The fact is they constructed incubators, giant incubators, instead of hay steamers. So it's important to prove that your system is working. The Haygain research shows that with a hay steamer you reduce by 99% the amount of respirable particles. It kills not only fungus, but also bacteria and yeasts. It does not alter the hay's quality in terms of minerals or proteins. It improves palatability, so that means that if you offer a horse steamed hay or dry hay, it's going to go for the steamed hay 100% of the time. It's also safe to feed up to 24 hours post-steaming, so if you have a horse going out traveling to a show, you can steam the hay and keep it with the horse for 24 hours, and then it starts to contaminate again after 24 hours. And I just wanted to show you a last little case. This is a horse that was referred to me for coughing, but only during exercise. This horse has dorsal displacement of the soft palate. As soon as he displaces his soft palate, it triggers cough because the soft palate vibrates on the arytenoids, which contains a lot of cough receptors. This horse had fungal contamination of the airways. It had received corticosteroids because it was diagnosed with equine asthma, so corticosteroids plus antibiotics. It continued coughing. It was put on another course of a different antibiotic, continued coughing, and was even worse. She constructed her own hay steamer, which was not adequate, and when we sampled the horses, I have never seen such a high amount of contamination aspergillus. Treat the horse here with antifungals, put it on appropriately steamed hay with a Haygain machine, and the horse never displaced again. So that allowed to control not only the coughing, but also the whole environment. And a horse with equine asthma that is sensitized can come with other forms of clinical symptoms, such as this one. These are some of our teams that regularly use the Haygain very effectively and will not revert back to using normal dry hay and even take it out to the show each time because they have felt the difference. So with that, thank you very much for your attention.